Welcome. Today's module is going to be diving into the field of population health and information technology. As we start to look at what this module is going to entail, we're going to have a few learning objectives. We're going to outline our agenda, and then we'll start talking about these two unique fields and how they intertwine together to make a meaningful impact in healthcare. So when we look at our learning objectives, first one's going to be the ability to define population health and how this idea plays a key role in the health of people, communities, and the world. We're also going to talk about how you can define information technology and the impact that this field can make in the actual area of population health. And last but certainly not least, we'll spend some time learning and discussing how you can describe the role of population health technology and how it integrates effectively and sometimes ineffectively with current healthcare technology, specifically like electronic health records. So when we look at the agenda for the next about 15 or 20 minutes, we'll spend some time talking about what is information technology, what is population health, what are some key components of population health, how is this applicable in some real life scenarios today, and what does the future of this field look like in information technology and healthcare. So when we look at what information technology in healthcare looks like, we have to start from the basics of what is information technology. Very straightforward and simple definition here of it's just the study or the use of systems for storing, retrieving, and sending information. With that, I'm going to take us a step into one specific area of information technology in healthcare, and that's the field of the electronic health record. With understanding how the EHR can play a role in healthcare, it's important to understand where has the EHR come from and what's that future going to look like for it. So if we look back to the origin of about 1960, it was the very first electronic health record, and this was created by a few academic institutions, mostly universities, teaching hospitals. One of the examples here would have been the Mayo Clinic that helped to create their own personal EHR. You also had organizations like the VA creating their own electronic health record as well. But a few of these organizations were their own leaders in creating their own versions of very simple electronic health records back in the 1960s. But we also look back at this time period. This is when the creation of three very important organizations was happening. This would have been in 1969 and 1979. In these two different years, three organizations were created: Meditech, Cerner, and Epic. Combined, these three organizations make up nearly 75% of the electronic health record market across the United States today. There's a pretty good chance that if you ever go to a hospital, whether it's an outpatient, you're being admitted, you have to go to the ED, you're likely going to have information tied to Meditech, Cerner, or Epic. So it's, I think, always important to look back and think about how important this time period was to what the field of electronic health records looked like compared to what it is today. After 1979, as these systems were being built and starting to be used, at this point, finally, the United States government got a little bit more involved and actually created the Office of the National Coordinator. This was just a governing organization inside of the government that was designed to help create some more regulations and specifications around the EHR. And the ONC, Office of the National Coordinator, is still heavily involved and works very closely with some of the modernization of the VA, Department of Defense, and other areas of healthcare regulation across the world, and specifically the US. Right around this time period, you also had the passage of the HITECH Act in 2009. This was entirely designed around making electronic health records more meaningful, specifically tied to the idea of just meaningful use, where we wanted to make sure that there were specific things that were being documented. There was care that was more values-based compared to just completing a visit or giving results to someone, you want to make sure it's value oriented. And that's where the HITECH Act came into play of incentivizing hospitals and organizations around the country to actually implement EHRs that help track some of these meaningful use items, whether it was reviewing allergies, medication reconciliation, completing a visit note, these different areas with HITECH. This is what largely drove the large increase in people using the EHR moving into about 2010 to what we see today. And in that time period, the use of an EHR grew drastically across the country. And when we look today, or about 2017, so a few years old of data here, but in 2017, over 96% of hospitals were recorded having been using an EHR. Today, that's well over 96, and we're approximately around 98% in 2020. So a lot of growth in just a short period of time with the electronic health record. So it's exciting to think about what does the next decade or even the next 50 years look like in this industry. As we look at how the EHR plays a significant role in healthcare, it's important to think about a few specific items here of computerized physician order entry, so providers ordering medications electronically and sending it to the pharmacy as an example. Just historical data storage. So for a patient, you can see your prior medical history, any old procedures, allergies, medication history, all of that stored electronically compared to sifting through old paper records. Patient portals. The EHR is a system that just allows patients and providers and other clinicians to communicate in a secure manner. You also have clinical decision support. One of the most common ways that this is used is through any medication and allergy interactions, where a provider can be notified if a patient has an allergy to a specific medication that they're being given. You've got barcode medication administration, where nurses or anyone who's administering a medication will usually scan that medication just to verify with the EHR that this is the exact medication that that provider was giving. And then the final one here, referencing back to the HITECH Act, where more regulations were being utilized. And EHR just helps streamline the actual use of these regulations and make sure that we're aligning to what the Office of the National Coordinator and the rest of the country wants to be doing with their electronic health records in healthcare. So that's how information technology plays a significant role in healthcare, specifically with the EHR. But we're going to take a step now and to talk about what is population health, and then how does population health tie into this electronic health record and information technology as a whole. So when we look at what is population health, when we think about healthcare, we automatically want to think about a patient in the four walls of a hospital and things that they're receiving clinically, whether it's medication, it's maybe a surgery. But population health really looks more upstream. We think more about that preventative health. We think about the health of an entire population. So when I look at that, I look at a very simple example here of just breaking out the word population health into its two separate definitions. So population, all the inhabitants of a specific area, and then health, just the state of being free from illness or injury. So when we look at that combination, that is what helps come up with this definition that was developed by Greg Stoddart and David Kindig, which will be two individuals that you'll read more about in our readings for this week. But these are two pioneers and leaders in the population health area. But this definition they came up with of the health outcomes of a group of individuals, including the distribution of such outcomes within the group. So just a very straightforward definition of population health, but at the end of the day, it's the biggest piece here of which it's the health outcomes of a group. And I think of one very simple idea of what this could look like is as a health system or a community, understanding what's the rate of people that have lung cancer from smoking in the community, or the number of children that are obese or overweight, or how prevalent diabetes is in the community, but being able to address healthcare through understanding what the population looks like. When we look at population health, I'm going to spend time diving into four specific areas. We'll talk about the social determinants of health, health literacy, data, and the quadruple aim. So our first one here of the social determinants of health, this is you can see in this image here, the 6 key areas of these determinants of health. These items that are upstream from the rest of the areas of healthcare. So when we think about healthcare, we oftentimes, again, think about the four walls of a hospital, but at this time, people may already be sick and they're now just getting treatment, and it's very reactionary in that final step. The objective here with this upstream concept is that we're providing care up at the top here with these social determinants of health. And we'll have some more readings in this throughout the week, but understanding how economic stability, people's housing needs, their education, what food they have access to. Are they eating fresh fruits and vegetables, or are they eating fast food on a regular basis? What does their community and social interactions look like? What's their access to healthcare? If they do get sick, do they have the ability to go to the urgent care? Can they get access to immunizations and other preventative measures? All of these items that, if addressed effectively, prevent people from having to go to the hospital, having to get that reactionary care. The impact of what happens with our social determinants of health upstream really controls what happens down the stream with everyone's experience in healthcare. So if we can focus on these 6 areas, it really makes a lasting difference. So that's our social determinants of health. We then go into the idea of health literacy, and this ties a lot into the social determinants of health, because oftentimes those 6 areas that are referenced can be improved if people understand what that information is and how they can actually take care of themselves and their health in that preventative manner. So when we look at health literacy, this is just the ability to use healthcare information in order to make appropriate health decisions. So I think of this as it's understanding what food you should be eating to take care of yourself, or when you do get sick, what's the appropriate way to manage the flu, or to isolate yourself from others if you are contagious with a certain disease, or how to wash your hand for 20 seconds, or whatever the requirements may be that you're looking at. But we think about health literacy, it sounds like a really simple and easy idea. But there are 3 specific challenges that we often see with the idea of health literacy. And in one of them, a very simple one, is just communication barriers. Oftentimes, the people that have the biggest issue with health literacy have that issue because they don't know how to communicate effectively, whether it's through a language barrier. Maybe the education they're being given is only in English and they speak Spanish or French, or English is just not their first language, so they don't understand what that information that's being given to them, whether that's written, or maybe someone prefers to read education and they don't understand anyone that's speaking to them, just like this over a video chat. If someone just can't hear by chance, maybe they would need this presentation to be written out for them so they could fully understand that. And that rolls right into the idea of the challenges of education. Health education has to be designed for people of all walks of life to understand it. You shouldn't have to have a medical degree to understand some basic healthcare concepts. Health education has to be designed where anyone at any level of education can understand what that information is so they can take the appropriate and preventative health measures. You also have culture. There are many communities around the world that their beliefs and their culture just do not align with what the recommendations are with healthcare. I mean, you look at things like vaccines as a great example of, there are many organizations around the world that have plenty of data and proven statistics that vaccines are the right thing to do and they're effective in your preventative health. But many people believe, whether it's through their religion, their culture, their own personal beliefs, that vaccines are not safe and not a good thing. And with that health literacy, you have to find the right way to communicate and have people understand